I think most people are in. Dr. B, you
All
can
right.
get this going.
Well, hi, everyone. It's Strategist Benjamin here from the American Public Health Association. I want to welcome you to our March Alliance for the Public Health meeting. And thank you for being here during, these are very much eventful and stressful times. We know that we can do more together than alone and hope that we can all benefit from having this time with partners in the community. We look forward to a great discussion today about communicating about the public's health, a topic that we've heard needs to be a priority for the Alliance and all of us in this field. Now, since we last met, we have seen the initial actions of the Secretary Kennedy and his staff and the DOJ, who have actually been cutting actions to federal agencies, addressing personnel issues by, frankly, both firing and then rehiring and then firing people with a real confusion right now. And then, of course, curtailing public comment and transparency through a lot of the actions that they had. Regrettably, we have this growing measles outbreak that we're continuing to chase. We're not ahead of it yet. We've not gotten our hands around it. And we're beginning to feel the impact, not of only the layoffs that are happening in government, but the impact of these layoffs to the extent that they impact private sector organizations. USAID is a great example where a lot of the global health organizations have lost staff because of the funding that has separately been stopped or pulled back at the federal level. And right now, it seems that the only thing really holding these folks back are the courts. And they're being defined because many of the things that they're doing are illegal or not following normal processes. And therefore, the courts have been able to put in a range of temporary restraining orders. And just recently, the court ruled that USAID, for example, needed to be put back to normal, including getting back in their own building. Next slide. Just want to remind you that we have these upcoming events. We have on April the 1st, a webinar that APHA is hosting on navigating the vaccine debate. I think this will be a really, really neat conversation. Dr. Paul Offit has agreed to be our keynote speaker. And then we're going to have a town hall to discuss some of the more critical issues around vaccines overall. And then, of course, National Public Health Week follows that on April 7th through 13th. Again, this is the 30th anniversary of National Public Health Week, so hopefully you'll join us to celebrate. In June, APHA has our Policy Action Institute, which is a 2-day hybrid event, and then that will follow with a legislative action activity. And then, of course, in November, our annual meeting here in Washington, D.C. Next slide. So I would now like to, of course, introduce our speakers for the day. We're going to talk about communicating about the public health. Our first presentation will be from Julie Sweetland and Katy Evans from the Frameworks Institute, and they're going to share some lessons about framing our work and how to discuss health and science and equity in ways that will reach the public and other audiences. Julie is a social linguist and a senior advisor at Frameworks Institute. She's been there since 2012, and she's designed and led reframing initiatives on things like climate change, education equity, childhood adversity, and more. She has a skill in translating and framing research into communication strategies that's really been helpful for many advocates, policymakers, and scientists to really drive change at the national, state, and grassroots level. And Katy Evans, who's going to join her, is a new person at Frameworks, as a senior director for their health justice program. And as many of you know, she has most recently worked with the Beaumont Foundation and led work to advance their public health communications work. So we know her very well, and has worked with many of our partners in these efforts. Then we're going to turn to Joe Finklestein, who will give us a crash course on crisis communications. Crisis Communications 101, and hopefully help us figure out how to deal with our current political environment and still try to protect and promote the public's health. He's a chief strategist at Brightstone Strategy. He has a very rich background in communications, campaign strategies, advocacy, and positioning organizations and branding. He's done a lot of work on focusing on climate, energy, and the environment. And I'm really excited about hearing this crash course from Joel. So now I'll hand things over to our speakers, and our first speaker, Julie. Julie, thank you very much.
Thank you so much, Dr. Benjamin. It's good to be here. I think in the interest of time, I'm going to hog the mic today. Poor Katie, but Katie, please, please, please help me out in the chat and help me in Q&A, joining in Q&A as we get going. As Dr. Benjamin just mentioned, I'm here today on behalf of the Frameworks Institute. We are a group of social scientists and social change strategists that conduct and share research on communications, culture, and cognition so that folks in the mission-driven sector can lead more productive public conversations on issues that matter and in times that matter. And we're certainly in public health right now fits that. We take an empirical approach to deciding to offering insights into framing in a moment. So for instance, when we do our large scale, nationally representative, randomly assigned controlled experiments on does this frame or that frame, right, get us towards the policies and the outcomes and the attitudes that we want. We'll often put common arguments or frames up next to each other, and we'll see things like this, that when we talk about, for instance, why we should be addressing the increasingly concerning trends in youth or child mental health. If we talk about that as addressing that issue as a way to advance our shared prosperity, get toward a brighter future, we can see and support for that type of work increase. And if we talk about it in terms of the vulnerability of youth and just how susceptible and fraught, right, things as they are to this time, then we see support for that issue decrease. Our interpretation of this is that people often hear vulnerable kids or vulnerable people as bad parents or broken people. And so thinking about, right, not just the words we're saying, but how people are hearing them. I think that's some of the value that we add to public health communications and other issues as you all are thinking about how to position issues. Right now, making those choices, right, of where to start, what to emphasize, and often what to leave unsaid, those framing choices now in this messy, confusing time are going to have a big effect on what's possible later. One thing we know from the history of social movements and major mindset shifts is that it's these moments of social upheaval and chaos where something new takes root in culture. If we want it to be the values and ideas that we promote and advance and hold as public health, we need to be out there in public discourse, using the strongest frames available to us. This is a moment of great possibility, right? And so what that possibility is, will things move for better or for worse, right? There's lots of things that affect that, but framing is one that we can have some control over. So there's a lot that could be said, and there's certainly many issues, right, being elevated. And so I tried to just think about what are the three things that we can remember to think about in terms of framing with all that's swirling around us. The first is prepare yourself to respond, not just react. And I'll say more about that. Two, it's really vital that we help people remember that a positive future is possible. And three, can we please stop with the self-inflicted wounds on the managing misinformation? Master the basics of countering deceptive and dangerous information. So I'll get into that. So in terms of preparing to respond and not react, right? Remembering that we don't have to speak out on every issue, right? A strategic response may be you know, I'm the best placed person to talk on this one, but I'm not the best placed person or organization to speak on that one, right? So thinking through what are you going to respond to, but not making those choices out of fear, right? And out of giving into a chilling effect. If we are giving into the chilling effect that folks are trying to create, we are in for some chilling times. And so thinking through how you can use the position, the power, the voice you have to keep important ideas in the public discourse and to think about that. Another way to prepare to respond, not just to react, is to do what you need to do to maintain your own poise and perspective, whether that's taking the long view, deciding to focus and prioritize just one thing, whatever that may be, right? Making sure you're doing the best taking active steps to keep your own poise and perspective and to keep your organization on an even keel. We can't freeze or go into turtle mode, right? As a sector. Otherwise, right, that's one way of giving in to the chilling effect. Another piece right now is to recognize and get ready for the reality that we're all going to have to get really good at, if we're not already, and if we are good, get even better at shifting perspective between the short term and the long term, or what some people sometimes call the short game or the long game, right? And that's going to involve shifting between crisis and communication tactics and the longer term strategies to change narratives and move mindsets. So Joel is going to speak to crisis comms. I'm not going to say anything more about that except to acknowledge that there are time-sensitive challenges in front of us right now that demand immediate action. People are being put in harm's way, right? So we do need to engage in crisis comms. And if we spend the next 2 weeks, 2 months, or 2 years only doing crisis comms, right, we're not moving to a very different terrain, the terrain where we could have the kind of conversations about public health, priority populations, and what America can and should be. So we have to do that long-term work as well. So one way to kind of say, oh my God, that's a lot. How do I do all of it? Is to remember that there's a deep and intimate connection between a particular message, right? The crisis comms you need to push out now, or the response to an emerging issue, that message push, and the long-term narrative shift. The messages we're putting out in a moment of rapid response should absolutely be adding up to, right, a larger set of ideas that we want to elevate in society. And that overarching narrative, right, should be informing each and every message we put out. So really trying to think about intertwining the two. It's a way of doing both, right, at the same time. All right, so prepare to respond, not react. Second is we have to give people a way to see that a better future is within reach. Americans, based on our
He's a sucking nap.
culture change research, are deeply dissatisfied with the state of our country, and people think things should change, but very few people are sure what they want that change to look like. People are open to very fundamental changes. Large majorities in our surveys are agreeing with statements like our society needs to be radically restructured and we need to remake our society in major ways. People are increasingly looking for something new and different, not the restoration of a supposedly better past. So understanding that, and also understanding that in this moment, something will take root, right? Do we want that radical restructuring to be reactionary and illiberal, or do we want that radical restructuring to be more equitable, just, and inclusive, right? And so thinking about ways we can remind Americans that doing it this way gets us things we want, right? And talking about those in positive ways. That can be done in the moment of the rapid responses that we need to be having right now. If Americans are having a trouble imagining a positive future, right, our challenge is not to convince people that that their problems exist. It's to convince them that they can be solved, and that we've got effective solutions. So right here, two ways of doing that immediate response on, for instance, protecting Medicaid. On the left, right, a story that's about vulnerability, right, ending healthcare for children, the poorest, most vulnerable Americans in the worst situation, right? It's a matter of life and death in this framing. And then, right, like leaning into, and gosh, there's not even a good reason for it. There are ways to tell a system is rigged story that can be very powerful for folks wanting to advance progressive change. I won't get into that now, but we can point you to those resources on that. And for now, I think a way to remind people simply that Medicaid is the way we offer public health insurance when people can't get private insurance through an employer. Maybe that's because they're unable to work, due to disability or illness, but maybe it's because they've got 3 jobs and none of them offer health insurance. There's larger kind of economic incentives at work, that really push, right, companies to not offer, right, those benefits. So talking about Medicaid as a way that we actually used our collective power and our shared values to give more Americans health insurance and access to health care, reminding people that it's a program that people believe in, 8 in 10 people enrolled, rate it highly, acknowledging, right, that there's always room to improve any system, but we can't improve a system if it's not there anymore. And then a call to action, like, here's what we can do, here's what you can do right now to help protect this essential piece of our health infrastructure. So that's giving people, right, getting away from jargon. It's not relying on vulnerability or crisis framing. It is offering what this is, why it matters, and what we can do to protect it. That painting a picture we can see needs to extend into aspirational vision type of messages. And in a moment like this, and to a personality like mine, that can sometimes feel fluffy. It can feel, the technical term, I believe, is a little woo-woo. But our research shows, I'm convinced by the research that we've got, that has shown that talking about a positive end state is really a strong and necessary framing intervention right now. We tested this just within the last few months, with rural participants, people in different areas of rural America, on the topic of health equity, specifically. And what we found in small group discussions, often conversations about health disparities and what it would take to eliminate them and advance health equity, very quickly went into us versus them talk. They went all, that's for the cities, it's not for us in rural America, right? That's about people of color. It's not about, right, us, the imagined, right, all white rural area. So you got a lot of, it's about immigrants, not about, real Americans. So a lot of othering, right, and us versus them talk. But we've learned 2 things about that aspiration can help to counter that. First of all, in a large and controlled survey experiment, we found that this aspirational framing built a sense, and even with that rural oversample, that we could make a difference, and specifically make a difference on racial inequities and disparities. And secondly, we found that in those small group discussions that started from an us versus them othering place, when we moved to that aspirational vision, the people stopped doing this, right, being against each other, and started thinking ahead, right, and it really dissipated a lot of that othering talk. So that looks like, we were working toward a Tennessee, an America, whatever it may be, where people are living a purposeful and happy life, and explaining what that looks like. My final point is that it's really important that we use our emerging and promising practices and the very few best practices that we have in managing deceptive and dangerous discourse. We are in a moment where the information environment is bigger, noisier, different, more fractured than ever before, and where falsehoods, right, are spreading faster, sticking longer, and being used, right, and weaponized in more obvious ways than at any other point. Anyone that comes on a call like this and tells you they've got misinformation and moral panic and all this sort of thing all figured out is probably not accurate in their self-assessment. But there are things that we do know that we can master the basics while we continue to learn how to meet unprecedented challenges. One thing is to think about what type of deceptive and dangerous discourse are we up against when you see something that you're just like, that's not true, that's not right. I like to, there are many types. I've got 3 here. There are others. Hate speech and conspiracy theories come to mind as other examples. But these are ones I think are quite important to public health right now. Misinformation and disinformation, for instance, on fluoride. Fluoride lowers IQ, right? That would be an example, right, of that. And someone who just heard that and repeats it, it's misinformation, somebody who knows good and well that they are cherry picking data out of context, right, to make that point about American fluoridated water right now, right? That's disinformation. A manufactured controversy, contriving debate to create confusion despite an established consensus. This is a lot of what we're hearing out of RFK right now. We really should study the safety of fluoridated water. Dude, it's been studied, right? We really should have a major study on the connection between autism and vaccine, the MMR vaccine, right? It's trying to create a debate where it's really settled. And then the third is moral panic. I'm not seeing this on fluoride, but we could get there. It would sound like, this is mass medication of the public and they beware what they're doing, right, to dumb us down. We're certainly seeing moral panic as it relates to people who are transgender, federal workers, other sorts of things. Is that the idea that these folks are deviant, dangerous, and out to get us. So thinking about which one you're up against in a particular moment of bad ideas going around is one way we can intervene more strategically. No matter which one, right? Thinking about our best practices, explaining what is true, giving clear. I say explain, don't just state, because we need to give people a way to understand how that issue works in reality. If people can have the impression and the experience of being asked to think for themselves, that message is more likely to stick and you are more likely to be perceived as a trustworthy messenger. Second, never repeat falsehoods. You're not debunking them, you are cementing them in the public imagination and mind. But you can speak directly to the fallacy by characterizing the unsound ideas as harmful or false or dangerous. You can warn people, right, that specific misleading moves are being made and worry aloud. I worry, right, that people are sharing these ideas to profit, right, from supplements, right, rather than focusing on what we know works, right. And to express care and concern, not condescension in moments like this. So, for instance, I saw this infographic going around. It's clear that this well-intentioned public health communicator learned a lot in recent years by making this very simple and clear, no jargon, a limited set of things to remember, a use of graphics as well, right, as text. But I would not be out there repeating the connection and wiring Americans to, in their mind, think vitamin A and measles go together somehow, right? We could try something much more like this. What's our headline? We want to keep kids healthy during a measles outbreak. We can rely on the measles vaccine because it trains the body's immune system to recognize and respond. We can remember that measles spreads very easily, and so they should isolate, but talking about isolate in simple terms. And tell people if your child gets measles, seek medical advice, talk to a doctor. Some home remedies in quotes can be dangerous. So I've warned against the fallacy, right? And but haven't restated it. I'm gonna pause there for now, so that Joel can share some of his ideas. But I'll just mention that we've got lots and lots of tested strategies and resources on a wide variety of health topics. And so you can find those resources on our website, get the short Cliff Notes version, and be pointed to them in timely manners via our social media, and sign up for our newsletter, so that you are among the first to know when we have new resources. Thanks so much for including in this conversation, and I'll stop there for now.
Thank you so much. And I know we will turn to Joel, but if anybody has questions, I see some discussion going on in the chat. So I would just ask you, Julie, if you'd like to look at that. And otherwise, we will come back to all of these things as soon as Joel is done. But thank
Hi,
you.
everyone. My name is Joel Finklestein. I'm senior strategist with my firm Brightstone Strategy, and I've been working on public health and the environment as critical issues that affect us all for 25 years. And I've been here to talk about, I have 15 minutes to talk about Crisis Comms 101, which seems short, but I will do my best. Let me share my screen. One moment. Okay. So, and I include way too many awful dad jokes, and I apologize for that in advance. So what are the communications we need to meet the moment? You know, going from the strategic to the tactical. The Frameworks Institute is incredible and does fantastic research about the overarching frames in which we communicate. But I'll talk a little bit more about the tactical challenges we face in a moment of crisis. And I think we should be real clear about what we're facing in this moment. And public health especially, I think, is uniquely positioned to play an incredibly important role in this moment. What we're up against. This quote has been in my head for 8 years, from Steve Bannon. I use his Wikipedia picture because it makes me feel photogenic. The real opposition is the media, and the way to deal with them is to flood the zone with shit. That is what we're facing, right? When we feel overwhelmed by the number of attacks on public health initiatives, as well as everything else that we read in every section of the paper or every section of the internet, it's a strategy. It's a purposeful attempt to distract and make us have a hard time responding. And I think acknowledging that and you know, modifying our behavior in light of that is critical, because we can't drink from that fire hose. No one can. No one's supposed to be able to. And we're challenged as a community that comes from a place of prioritizing science and data and substantive response as a first principle good. But there's so much coming at us so quickly. If we respond to every attack or every world-shattering event in that mode, we'll never keep up. So what should we not do? What we should not do is play whack-a-mole, right? In my opinion, it's tempting when, you know, every line item that's cut at USAID affects 50 million people, is an incredibly important substantive issue, or every conversation about vaccinations, every piece of it we know will hurt people that we care about in our community and society that we care about. Despite the desire to push back, we can't win the conversation that way, which is really what I think our challenge has to be. How do we protect what's worth protecting? How do we define what's worth fighting for in a moment when so many conversations are happening so quickly? I'm not going to talk so much about the specific messages. That's more what frameworks talked about in, I think, a really constructive and useful way. But I want to talk about the tactical responses of what to do. And I'm going to frame them because, you know, heuristics are fun with the 4 Ps of crisis communications. What is the first P? I had to go deep in the thesaurus for some of these Ps to find words that work, and mostly I did okay. But the 4 Ps I propose are that precision beats a panoply of responses. Preparation beats panic. I'll talk about each of these in turn. Speed beats perfection. I couldn't really figure a better word for speed there. And practice makes perfect. I think speed is an honorary P. So what do I
Well,
mean?
I'm going to stop you for just a second. We're seeing your screen, so we're seeing both the current slide and the next slide. If you just want to change it to presentation
Ah.
mode.
I did not realize. I'm sorry.
You just simply need to go to display settings and just click on swap. So see where it says display settings, the second part? Yeah, click that
You
down
can see
arrow.
my there.
Just click, no, keep going up higher and it says the word display settings and the little down arrow next to that.
You can actually see my mouse, so I feel like I should be able to. I apologize, everyone.
No, I just wasn't sure if you had notes that you didn't want from.
So
there
just,
it is.
yep, just swap the first
Well,
one.
I apologize.
There you go.
know my good jokes coming up, and that breaks my heart. Luckily, you've seen they're not that good. Okay, let's keep going. So let's talk about precision beats a panoply of responses. I can't emphasize this enough. I do feel like we're so overwhelmed so often in what we're facing right now. We have to choose our spots. If you push back on every breaking news item, you will not effectively counter any of them. And I think that's the challenge we're facing. This is a strategy, as I said, to overwhelm and distract. Rapid response does mean being fast and responding where appropriate, but it means responding enough that you can do what you can to control the conversation as often as you can. I think one key way to do that is to have a consistent frame undermining all your specific messages that can support the varying issues that come up. So, and that goes back to what frameworks talk about, right? If we have these big ideas of the type of world we want to fight for, every specific interaction becomes a way to have a conversation about that larger vision, that larger framework for how we think about the world. I think it's worth saying that, to me, public health is uniquely positioned for this, because at root, we talk so much as what is public health? How do we talk about public health in this moment? I believe there's something fundamentally optimistic about public health, right? It is the idea that by working together, we can make all of us safer. It is a fundamentally optimistic vision for the future. And I think it very much contrasts with the nihilism that we're seeing from the Trump administration in many ways, right? The idea that it is impossible for good things to happen. So among the reasons that it's a way to change hearts and minds, as Julie talked about, I actually think it also is very aligned with the core of what makes public health public health. And so if you have that consistent frame behind all the specific reactions, but you really focus on your moments and choose to engage proactively and respond aggressively, reactively, when it's a conversation that you feel needs to have, you'll be much more effective, I believe, in breaking through. So preparation beats panic. It is very tempting when we are facing a crisis communications moment to run around like a chicken with your head cut off and look busy. And that kind of means you've already failed. I am a big believer that the best way to respond rapidly is to have started a month ahead of time. The second best way is to start 2 weeks ahead of time. The best way is to start the day before, right? You know what I mean? You want to think ahead and have your response prepared. This is made possible in part by picking your spots, right? By the previous item. Because if you're focused on a handful of proactive communications moments, you can have true preparation in terms of fact sheets, talking points, sources for reporters to contact, and anecdotes, stories. I can't emphasize enough. I think the public health community is in this incredibly unique situation that you truly are woven into society at every level. There's public health officers in every county, in every town, all over America. And those stories about the good that's been done there, and also, frankly, there's a moment to bear witness to bad things that are going to be happening on the ground that we all know are coming, is an incredibly unique situation that, among all the issues that we're also concerned about right now, the public health community is uniquely positioned to help tell that story, and that it'll take preparation, it'll take work ahead of time, but this all feeds into, to the degree that we're talking about media relations, which is of course only part and less of a part of your communications plan these days. But even in direct communication with communities, the goal is to establish yourself as a credible information source, right? That is possible with preparation, with having your ducks in a row ahead of time. I think there's so many challenges about understanding where credibility exists in communications these days that has never been more important. Okay, one moment. So speed. Pardon me. That said, when you're prepared, you can respond swiftly and with substance and meaning. And one of the challenges that many communities that are based on data and science and reality is that sometimes the best can be the enemy of the good, and we can't get out from in front of ourselves in terms of responding on the speed we need to. So in those moments where we pick spots that we need to respond, we need to be fast and we need to be first. So the 15, 30, 60, 90 rule is essentially when a news breaks that fits into your chosen area of rapid response, you should have something, a placeholder statement out 15 minutes after it happens. Even if you don't know much yet, just say you're looking into it. 30 minutes, have a deeper statement, 60 minutes, 90 minutes afterwards. You can evolve your gather information. Hopefully you have it prepared because this is an area that you've chosen ahead of time to focus on. And get engaged in conversations with the media and with communities, wherever these conversations are happening, right? On the Facebooks of the world, on Nextdoor more and more. It seems like that's an important pathway for meeting communities where they are. But responding in real time swiftly, not going over your skis and making stuff up because you prepared and you have your credible knowledge base and anecdotes. Especially with media, which still can drive conversations, as we know, even though regional media is less and less. Being in the conversation early is critical because the first conversation a reporter has when an issue breaks informs every other conversation they have. It sets the framework of those conversations. It sets the questions that they're going to ask other sources. And now we're often going to be in reactive mode, so maybe we didn't break the news, but still getting in early with a response can help set benchmarks for all the follow-ups to come. I do think this is where in various public interest communities, we know it's hard to sometimes have an approval process. It is critical to create an approval infrastructure that lets you be fast to respond, especially, that's where preparation comes in too, right? If your talking points on an issue are 90% of the way there and then can be adapted by 10%, which needs less sign off, for example, you'll be able to respond faster and influence the conversation as it's happening in the cycle that breaks. And then the last point I'll make is that practice makes perfect. I always think about in Groundhog Day, right? I think someone calculated that Bill Murray was in that loop for like 10,000 years. So he got very good at things. When it comes to crisis communications, it is a skill that gets better by doing it and investing the time. So with the preparation, but also to just get on that sort of rapid response crisis footing while we're in this moment. And I have a handful of slides about what that looks like to come prepared and know who you're talking to be concise, to contextualize the conversation, to control the interaction with media. Angie, I'm not sure if we have time for me to present those or that can be sort of bonus tracks for anyone who might want it later. But
Go ahead quickly if you'd like.
okay, yeah. So I consider these the basics of rapid response communication, the basics of the basics. The first is to come prepared. With any media interaction or any interaction through social or any other network, know who you're talking to, find out everything you can about the audience. If it's a reporter, Have they commented? Have they written stories? Have they taken a position in the debate? Who are the other sources that they're frequently want to go to? Know what your role is, right? The role that you play and the different people on this call have different roles that they're going to play in these conversations as they break. Think hard about the role you want to be in, the role that the, let's call it reporter, talk about media specifically, puts you in their head. Develop your messages. Obviously, we've talked about that. Identify potential negatives and tough questions, right? Do that exercise. Again, something that can take place ahead of time with preparation. Think about the hard questions that are going to come in a conversation. The basics, part 2, concisely deliver your message. When you're talking to a reporter, whether it's in person or electronically or on the phone or in Zoom, listen to what they say, right? Listen to their tone and body language. Respond with your key talking points. And, you should have those locked and loaded and practiced, especially because, again, you're choosing your spots, you're preparing. You can expand on that depending on the type of conversation you're having. Is it sort of a wide-ranging discussion? Is it a quick response? And you can present a couple points as background and then stop. That's something that I know I could get better at. I kind of just failed at this test. Make your point and stop talking. Don't repeat the charge, which Julie talked about before, right? Don't say the accusation against you. The greatest example of this of all time is I am not a crook, right? When you say that, everyone forever thinks Nixon was a crook because he said he wasn't a crook. Don't repeat the charge. When you're done making your point, stop talking. Don't fill the silence with the reporter, which is a tool they teach in journalism school, right? You'll answer a question and you'll be done and they'll just look you in the eyes and wait for you to keep talking because they want you to go off your talking points sometimes and be more fluid and human sounding rather than talking point sounding. Don't do that. Sit there and be silent at them. That's totally valid. And I have a much longer conversation I have with folks about media interaction in general, but it's important to remember that an interview is not a conversation. It's meant to look like a conversation. Reporters want it to feel like a conversation. It's a fundamentally different interaction, a different thing. And you get better by doing, and by practicing, both with the reporters and before you talk to reporters. Contextualize the conversation, stories to flesh out your messages and your argument. We talk about statistics, something that we're very good at in our community, but picking, the killer app statistic, the perfect example is important because numbers numb and jargon jars, right? And we can be right and still lose. I can't emphasize that enough. I've done a lot of work on climate change for the last 25 years, and I'm very good at being right and still losing. I'm trying to get worse at that. But, we need to pick our numbers as an illustrative point. But again, the stories that the public health community will have access to, God help us, over the next 4 years are going to be powerful and meaningful, and no one but you can really tell them. And I think positioning yourself in a way to be an intermediary for those stories is such an opportunity in this dark moment to change our path forward. And then finally, these are very, very tactical now. The 2 basic tools that I always point to of controlling an interaction with a reporter or an opinion leader on social or anywhere are flagging and pivoting. While you're having a conversation, you can always go back and always say the same thing, your core talking point over and over again by saying the bottom line is the most important thing. The biggest problem is, and then say your core talking point. You're allowed to repeat it until they get it. You probably have to repeat it multiple times until they get it. And a related skill in a critical school is pivoting, sort of the bump and run of when a question is asked, you can answer it very quickly and factually, and then pivot to your core proactive message and your proactive frame. That's a great question, but one important thing I think is important, and I'll look into that, but it's also true that these are very tactical skills. I have exercises that I train people on about practice, because practice makes perfect. We had a golf metaphor before, right? And Gary Player, one of the great golf masters of the 20th century, used to say, golf is all luck. The more I practice, the luckier I get. And I think that is very true for communications with media, especially around these specific skills. So thank you. I apologize that the first half of my presentation you saw the back end, but I appreciate it. I'm happy to answer any questions. My contact information please reach out anytime for more. But I think we're at a moment of transition, a moment of transformation, and the public health community has a critical role to play and a unique role that you're able to play at this time. Thank you so much.
Thank you so much. And I'm gonna we'll open it up to questions. And I know there are a couple that are in the chat that we'll come back to, but just a question both for I would say Joel and for Katie and Julie would be something I know I am guilty about, and I think most of us are right now, is getting to that the sky is falling mentality. But trying to keep things positive, and also I think communicating what Joel said, those stories or the examples of what is not working now and what is really bad and where the sky really is falling. Like, how do we balance those tensions, or how do we do that successfully?
Yeah, I hope I didn't come off as suggesting that we should suggest everything is happy, happy, joy, joy. It's fine. This is fine. But reminding people of our shared values, the value that's at stake, and it's deciding on that message based on research about what will resonate with the broadest swath of your audience is one thing we can do to orient people to the issue in a more productive way. Explaining, giving people a slight amount, just the right dose of background information. For instance, right, that Medicaid is the way we give people public insurance for those that can't get it through their private employer. Doing just a little of that, and then saying, right, we don't need to walk away or dilute, right, from the sense of that this is urgent and important. But orienting people with values has a priming effect that's helpful, and works to your advantage. A little bit of background information allows people to follow along and again, experience thinking for themselves. Without that, it often can sound to people who are not yet involved that it's there they go again, politics as usual, left screaming it right. And people are more likely to tune out because it sounds to them like getting involved means getting in a fight. So we can be sharp, we can be firm, we need to be taking stands, absolutely. But thinking about the structure of that strong, sharp message is one way we can prepare to respond, right? Not just to react, which may be, right, from our position of expertise. Oh my God, this is, right, a whole disaster. But most people don't think about most issues most of the time. And so remembering that as you're doing that rapid response will make your essential intervention more impactful.
Yeah, and I'll add from the tactical perspective, it's kind of well, when you're dealing with media specifically, right, there's a related issue here, which, as we know, if it bleeds, it leads, right? And so there is going to be a role for factually documenting the bad things that we know are going to happen, right? And that will get attention to these issues when you're pitching media specifically. But even when talking about them, you can frame the solution positively. Again, I think there's something so fundamentally optimistic about the idea that we can work together to make things better for people, to make Americans more healthy. Fundamentally optimistic. And it doesn't it's easy not to feel optimistic all the time at the moment, but that is really core to what makes this community. And so you can document what's bad and say we can do better and have a better world. And in fact, I think we should, because that's the truth. As my old boss, Jerry Nadler, used to say, it has the added advantage of being true.
I'm going to follow up on something that was mentioned in the chat, and that is that we do have a lot of words right now that have gotten politicized. Do we talk about equity? Do we talk about, I think the suggestion was DEI hires? Do we talk about, public health, which is sad? What do we do to kind of navigate that in these times also? And I know I will also point out, Katie put another great resource that De Beaumont did recently in the chat for folks.
Now, the politicization of terms is hard to keep up with. And sometimes, So I think a framework for thinking through what to do is more helpful in this moment than, being a live thesaurus. But thinking about if the idea that word is expressing is helpful and productive, for instance, equity. If you can, continue to use the term. If you can't use the term because you're under a specific prohibition, find a close synonym. Either way, the explanation is more important, I would think, than the lexical item. Thinking about helping people understand what you mean in plain and nonpartisan language and making those decisions with others in the sector, right? So that if we're starting to offer alternatives, we're doing that together and harnessing the power of repetition. But when an idea is harmful and unproductive, fake news, radical gender ideology, DEI hire, right? I would not be repeating those terms. Instead, I would speak to, doesn't mean you just go quiet and stop saying it, right? You can speak to the intent and the impact of those harmful ideas. So eroding our trust in journalism, singling out, right? A tiny minority for the way they've chosen to express the way they express their gender, right? Things that some of the impact, and again, doing that work in community, particularly having those conversations with any groups that are being scapegoated or demonized, right, by these weaponized terms. I think that those are kind of the again a way to prepare to respond, not react. There's a whole new addition to the list of bad words in American government, right? Every day. So, so this is our best offering on how to, again, how to think it through, not just what to say instead. That said, the phrase talking about people's dignity, and how important is it we respect the dignity of communities and individuals, through health, and what we do in health is the value that we found was the most productive entry into health equity conversations, with folks in rural areas very recently. Sorry, Joel, go ahead.
No, I mean, I second everything you said. The problem with just not using the word is they'll come up with the next word that they'll take from us, right? Before it was DEI, it was CRT, right? And before that, it was 10 other things, right? The echo chamber of the current American leadership is powerful, right? I've said a couple of times that the presidency always has a bully pulpit, never more than now, and it's an actual bully at the pulpit. And I think we need to be honest about that in figuring out our responses. I agree that so much of on equity specifically, so critical to what we do, such an important and misunderstood concept. But I will say to be I don't know if this is provocative or not, but to me, before it was politicized, it was jargonized, right? It is a great term for communicating to each other, and we should keep doing that because screw them, right? It means something. It's a term with meaning in terms of how we create solutions for public health in this country. But most people don't understand it, didn't understand it, under Biden, didn't understand it under Obama, didn't understand it under Clinton. And that's too bad. But the meaning of it is critical. The idea of, doing right by people based on making sure they have dignity and health. However, we get to that essence, that fundamentally optimistic essence of what public health can bring to our society, I think is more important than the word. And I think, especially at the risk of violent communication, the fact that it's asymmetric warfare means that if they want to take a word from us and sort of vilify it, right now they can do that. But there are more important ways to talk about the substance of what we're trying to get across than the words themselves.
Yeah, Joel, I'll just add to that, Julie, you can weigh in on this too, but a lot of the words we use, people don't understand anyway. Most Americans couldn't define public health for you or equity very effectively. So I think there's an opportunity to explain the concept more than adhere to the word.
Yeah, in fact,
I'm trying to find your pen.
yeah, when we did research on the term equity, Most people think it means how much you paid down your mortgage, right? There are financial connotations with the term. If you Google the term health equity, the first thing that comes up is a way to enroll in a healthcare savings plan, right? So and so, while we have as a sector adopted the term to talk about moving towards justice and fairness in a way that does not rely on uniform one-size-fits-all responses that ignore history, right? Like that's kind of what we mean. I know it's more than that, but I'm speaking in first draft here. Getting that idea across by giving Americans the sense that somehow equality is a bad thing now, I don't think we've done ourselves a huge favor there. So explaining what we mean and what is true, again, it makes it harder for others to misdefine and mischaracterize the term. So yeah, Katie, agree totally with that important point.
I have two. I'm going to kind of summarize a couple. One was just how do we get local media and kind of local partners involved? And then another were, and we can follow up with this after the meeting also. We've heard a lot of presentations on how do we do this. It's really hard. Are there some kind of synthesized or combined things on how we could train our staff and our organizations on how to do this work?
Well, you want to go first, Julia, or should I?
No, I was going to say, geez, I wish there was, but if you've got one, I mean,
Yeah.
we're working on something that I think will serve some of that function, and it should be out by May, but it's hard and complicated stuff. There's not a shortcut, I don't think. Joel?
Yeah, I'll say, I mean, at the risk of being modest, I think Frameworks is one of the ones doing this the best, right? Because they think in terms of cognitive frames and big picture ways of talking about these very complex issues that a lot of messaging organizations get deep in the jargon. I think Spitfire is an organization you may know has a lot of great resources where organizations of multiple sizes can do this internally on their own. The Spitfire Smart Chart, former colleagues of mine work there, you may have heard of. I do this, not to put too fine a point on it. Lots of us do this. I do think I certainly, when I take on these conversations, I'm trying to winnow down into, best practices. There are exercises and trainings to get better. Like I said, practice makes perfect. In terms of local media, that is a challenge as there's less and less local media all the time, right? So much of it has been bought up. So many of our information pathways that we relied on to, the model of doing national advocacy and getting a story in the local paper so that the local member of Congress sees it and takes action on the Hill, that's gone, right? Oftentimes local papers don't even cover local issues. There is an evolving infrastructure of parallel communications pathways that have evolved. I think Eli Pariser, one of the early innovators in MoveOn, has done some interesting work about activating the next doors and Facebook pages. There's a group called, what are they called? Well, there are groups that are doing information around sort of interest groups on Facebook that can be used for advocacy, but are built around sort of community options. But there's no one size fits all, and there's less one size fits all than there used to be. I do think there are ways in a lot of communities to get conversations happening on the ground through local social platforms more and more. I think there are ways to do there's still local media that's worth pursuing where it does exist. It's more influential and powerful than ever because there's so much less of it, right? So where there are local reporters you want to reach, it's about finding a story that to them is meaningful. I do think in this moment where so many of the existing pathways have disappeared, a group like APHA and others who are able to have memberships or allies in communities around the country are an invaluable network in themselves. I think that's a critical communication pathway, more critical than ever before, since you don't have you don't even have an AP desk in every state capital, right? But if you want someone in every community to know about it, no one's, what is it? Like Larry Bird's not walking through that door, right? We are the ones that are going to have to save us. And I think that's true in communications too. I think we are the ones who have to realize that we need to communicate directly at some of these levels more than we ever have before. But local media still does have a role to play, certainly, and I think it's critical.
Thank you so much. I know we are at 3. I will just also say we'll ask our speakers, and we'll see the notes and also say if there are other resources. I know we mentioned at Beaumont, there's also the Public Health Communications Collaborative, which I know has some training on health communications. So we will try to put together a list, but once again, it's a list. So I think it'll be great for all of us to figure out how we practice this ourselves and move ahead. But thank you so much, Julie, Joel, Katie, for joining us today. It was a really great discussion. We got amazing thanks in the chat, and we will look forward to hopefully practicing what you've taught us and getting better at promoting that vision and getting ready to talk about public health equity and all.
Yeah.
Thanks so
Good to
much.
be with you. Thanks for convening the conversation and including us.
Thanks so much. And to everybody else, we will see you at our meeting in April and look forward to talking to you all then. Take care.
Take care.